Welcome to In Depth. Imagine, if you will, having to make a choice. Do I spend my money, what little I have, on food or on medicine? Chances are I should ration my health care, but will my children be able to have food? Well, that's happening to millions of Americans, including many right here in the tri-state. So what do you do? Joining me tonight is Gina Gibson. She is the Executive Director, CEO of the Evansville Christian Life Center. She is author also of the book, The Community I See, Why I Have Hope for a Better Evansville. Gina, thank you so much for being here tonight.
Thank you.
You say you are trying to fight poverty and strengthen families right here in Evansville.
Absolutely.
First, I think a lot of people understandably may not be aware of the scope of poverty right here in our community. Tell me about that.
You know, poverty is affecting people in many, many ways. And as the healthcare costs and as food rises and gas prices rise, those families just can't afford to keep up. And so there are so many in our community that are doing without. And that's what the Evansville Christian Life Center is trying to do, is trying to help meet those needs.
And we're talking about a lot of people here. The poverty rate in Evansville is estimated to be between 20 and 22%. That is
Right.
1 out of 5 people
Exactly.
in this community.
It is.
So where do you begin? Where have you begun to try and make a dent in this in helping folks?
Sure. We have a couple of places where we've tried to help this and move the needle forward. You know, we feel like our goal is to help families. People are recommended to come into the Evansville Christian Life Center. We have a GAIN Anti-Poverty Initiative program where they can be a part of that, and we help them on their journey, walk on their journey out of poverty. But we also have a healthcare clinic. You know, healthcare is a big deal, and it puts people into poverty if they weren't there before. And so we have medical needs we meet, pregnancy needs, and dental needs.
And we just saw a photo of that, rendering of
Yes.
that clinic.
Yes.
Tell me, as far as how this works, though, the insurance, what happens, say, if you walk through those doors and you
Sure.
may have a child who has a bad sinus infection or
Sure.
possibly strep throat or what have you.
Yeah.
Walk me through that.
You know, we're for the uninsured, the underinsured, or for individuals just like myself. And I say that because if you're someone who are uninsured or underinsured, we're going to base it off of a sliding scale fee based off of your income. And we don't let anyone not receive care. We're going to make sure that everyone who walks through our doors gets care. But for someone like myself who does have insurance, you know, I don't have a family care practice. Dr. Mine moved out of Evansville, and so I don't have one. And so I can go to our clinic, use my insurance and my copay, pay that to the clinic, and I'm paying it forward for someone who can't afford medical care.
And for people who cannot afford medical care, just getting into this clinic, I assume there's a fear factor. Am I going to
Sure.
be turned away?
Yeah.
And you tell me that insurance plays a role on this, but the impact of, say, like prenatal care,
Right.
and the impact that could have on children
Absolutely.
later on in life. Why is that so important?
You know, the prenatal care, so our pregnancy care services, doing a pregnancy test, an ultrasound, and STD testing is at no charge, period. Bottom line, we want to make sure that we help that young woman, that young mama, or thinks she might be a young mama, walking through the doors. We want to make sure she gets the care. But the prenatal care is the most important part. We have, in the state of Indiana, a very high infant mortality rate. And because of that, a lot of them were not able to get connected to their Medicaid quick enough. So we had at one point women walking back through our doors at 30 weeks along and had never seen a doctor. And so we want to help them get connected to that care.
And speaking of being connected, it is connected as far as, well, diet is concerned. Research has shown a lot of individuals who are on very low incomes, they tend to go to more processed foods.
Right.
Foods loaded with sodium, fat, sugar, etc., and that can cause future health issues. So you're really starting, what goes around comes around.
Exactly.
And how does the clinic help, and how does the Life Center help that?
You know, one of the things that you just said, you said that healthcare begins way back on what you eat. And, you know, unfortunately, the processed foods and the junk food is cheaper than what the healthier choices are. And so we're trying to help them get connected. We have a food co-op that folks in our Gain Anti-Poverty Initiative can be a part of. And so we try and help them get connected to healthier foods. But we want to make sure that they're coming into the healthcare clinic and getting those checkups and things that they need, that you and I go on a regular basis. You know, folks in poverty may not have a general practice doctor. And so that's what we want to be for them. We want to be that. We want to talk to them about healthier choices. We want to talk to them about where they can start. Because if they didn't grow up in a family who ate healthier choices, they're not going to know where and how to do that.
And you can find out more about the Evansville Christian Life Center and this health clinic on their website. Gina Gibson, thank you so much for being here tonight.